Hello and good afternoon. I'm Tom Prislak. From the people of Cedars Sinai, welcome to the debut of Embracing Our Community Live. Today and well into the future, we'll be hosting conversations with leaders who are empowering Los Angeles to grow stronger. Our intention, our hope really, is to provide a platform for our partners to share their expertise on some of the most pressing issues facing our community. Our focus today is homelessness in the time of COVID-19, and we've been looking forward to this for several reasons. The first reason is that we have three extraordinary leaders on our panel: Lecia Kellum, Elise Buik, and Antonia Hernandez. They're each a source of inspiration and encouragement to my colleagues and to me personally. More on each of them in just a moment. Second, we're excited because you're here. Our guest list today includes leaders in education, city and county government, houses of worship, community clinics, foundations, and other nonprofit partners and members of the Cedars Sinai family. And third, we're excited because from experience, we know that when capable community leaders connect with a dynamic audience, good things happen. I want to say a word about why our medical center is hosting a conversation about people who are experiencing homelessness. The answer goes back 118 years to 1902, when Cedars Sinai was founded by members of the Jewish community who wanted to contribute to the health and well-being of Los Angeles. That was the birth of our mission, to bring healing to those in need. In 2020, we fulfill that mission in our clinics and in our inpatient units, our classrooms, and our research laboratories. And apropos to today's program, we fulfill it by providing services and grants to dozens of essential organizations in the community and through partnerships with exceptional leaders like the three represented here today. Our topic is immense. In 2018, there were 59,000 people experiencing homelessness in Los Angeles County. Today, just 1 year, that number has now grown to 66,500 people. Each of these individuals has their own personal story and their own health considerations and concerns, not the least of which is COVID-19. There are many forces behind this troubling trend, and they require the right solutions. And I'm very glad to say that our panelists and their teams specialize in solutions. The first time I heard the phrase, people experiencing homelessness, it seemed like a few more words than necessary. Why not just say the homeless? There is a reason, and I believe it's an important one. When we talk about the homeless, it's almost as if we've made an unconscious assessment. We've decided that's who someone is, that homelessness is not their lot in life, is their lot in life. But it isn't. Homeless is not an identity or a characteristic. It's not someone's fate. It's a circumstance. It's something that happens to too many of our fellow Angelenos. So this afternoon, we are excited to host a conversation with three leaders who are opening doors for those who, at this particular moment in time, and for a complex array of reasons, are experiencing homelessness. I'm pleased to say that our moderator today shares our panel's sense of possibility and their faith in collaboration and constructive action. It's a pleasure to introduce our Senior Vice President for Advancement, Art Ochoa. Art?
Thank you, Tom, and welcome everyone. As Tom said, this is our maiden voyage of Embracing Our Community Live. Thank you for helping us launch what we hope will be a very worthwhile series. Given who's watching today, we know you each have very busy days and lives, so we especially appreciate your joining us. We do have three exceptional guests today. Dr. Lecia Kellum is the president and CEO of the indispensable St. Joseph Center. Over the past 12 years, she has led the center's extraordinary expansion across Los Angeles County. She's a very active supporter of the National Alliance to End Homelessness and the Los Angeles Homeless Services Authority Ad Hoc Committee on Black People Experiencing Homelessness. Dr. Kellum also holds a gubernatorial appointment to the No Place Like Home Program Advisory Committee, and she is the former chair of the West Side Coalition. Antonia Hernandez is president and CEO of the mighty California Community Foundation, one of Southern California's largest and most active philanthropic organizations. During her tenure, the foundation has granted nearly $2 billion focused on health, housing, education, and immigration programs. Antonia is the former president and general counsel of the Mexican American Legal Defense and Education Fund. She serves on several prominent boards and commissions, including, and I promised that we wouldn't be talking about this tonight, the Commission on Presidential Debates, and she's a fellow of the American Academy of Arts and Sciences and the American Law Institute. And to round out this amazing trio, Elise Buik is the president and chief executive officer of the legendary United Way of Greater Los Angeles. With her at the helm, United Way has transitioned into an innovative community impact organization with a very ambitious 10-year plan called Creating Pathways Out of Poverty. She serves on the boards of the Pacific Council on International Policy, the Los Angeles Area Chamber of Commerce, the USC Price School Board of Counselors, and she is the former chair of the National Professional Council for United Way Worldwide. A huge thank you to each of you for sharing your afternoon with us. You represent essential organizations. You've built truly impressive teams. You have a deep understanding and appreciation for our community, and you serve its many needs with determination and distinction. One housekeeping note for those of you who are listening, if you have questions for our panelists, you can use the Q&A button at the bottom of your Zoom screen. On the other hand, don't use that chat function because it's been turned off for this webcast. And with that, let's begin. So my first question is for Lecia. How would you describe the intersection of homelessness and health?
Well, it's a really good question, and thanks so much for having me. We've really seen through the outbreak of the pandemic that homelessness is tied to public health and housing is health. Sadly, so many of the people who are homeless on our streets and struggling every day were unable to stay safe and ensure that they did not contract COVID in the way that all of us do, wearing a mask, washing our hands, taking showers when we're out and about. Those simply are things that the homeless population cannot do. And so we really see that there is a true connection to health, to public health, and making sure that homeless citizens are able to make it into homes that are safe and that allow them to eat and sleep in places where they are welcomed and where they are able to live lives like all the rest of us.
Elise, can you share how COVID-19 has impacted your work in the homelessness space over these last few months and maybe share some bright spots and some interventions that have surfaced?
Sure, and thank you so much for having me in this important dialogue for people that are very vulnerable. You know, I think that if we can all go back to March and remembering how our world's changed, that we were hearing things on the news and online, but can you imagine, like, everybody to pause and imagine that you're in a tent and the world stops and you have no idea why. You have no access to many of the services, food, charging your phone, and community that you've seen on the streets. And so it became a very quick pivot of, you know, at United Way, we really try to work on longer term solutions, but it really became, Art, a very quick pivot of getting basic supplies out to people. So if you can remember, we were all scrambling for masks and gloves and hand sanitizer and toilet paper and food. And so that's really what we galvanized around, is just to make sure that people on the streets were safe. Now the focus is more safety through the lens of health. And I really want to thank Cedars Sinai for your leadership in stepping up and really looking at health pathways. I think for us, what it has proved is that we can move with urgency. We were able to get people housed very quickly through this crisis. And that's what gives me hope, is if you can do it in a crisis, then there are lessons in that we can learn. Now we're really prioritizing those most at risk. And so in our partnership with actually everyone on this panel, we're really looking at our senior citizens who we know are very vulnerable to this virus, and looking at people who have underlying medical conditions. And so you can imagine, and I know the Cedars family knows this, but when we know that folks that have hypertension and diabetes are very vulnerable to COVID, we have to find those people on the streets and take care of them. I remember when you and I talked recently, the thing we have to hold in our minds is that homelessness takes a huge toll on people's health before COVID. So the average life expectancy of someone on the streets is 57 years old. And I know you looked it up, and we figured out that that's the life expectancy of someone who lives in South Sudan. So that was before COVID. So COVID really shows us that the stakes are higher, but we are starting to see innovative models of how we can deliver healthcare to keep people safe and healthy during this crisis.
Thanks. And that's certainly a lot to reflect on and think about. We'll come back to some of that in a minute. I'm wondering, Antonia, from your perspective, as a funder, as a thought leader in this region and nationally, how can healthcare and healthcare organizations support the efforts of organizations that are on the front lines in the fight to prevent and end homelessness?
Well, the basic question is, can a person living on the street be healthy? And the answer is no. So there's the synergy that you need people housed with a roof over their head before you can really deal with their medical issues. So housing and health are very much linked together. And, as we talk about, the homeless, Southern California and California has a housing crisis. It's an extraordinarily complex issue, particularly, since COVID and a lot of people losing their jobs. At the California Community Foundation, not only are we supporting the building of permanent housing, working with Elise and United Way and funding organizations that do that, but we're also very worried about the rental and eviction tsunami that's going to come. And so, creating funds, bringing in funds to keep people in their homes, in their apartments. Tom indicated that we have over 66,000 people in LA that are homeless. Well, can you imagine what it would be like if a lot of the folks in apartments, homes, are evicted because of their inability to pay rent? So you have to look at the housing issue from different perspectives. And let me give you some bright spots, because one of the messages I want to send to the public is that this is a solvable problem. And that we have to understand that every time you see a homeless person on the street, that they are one of us. You cannot dehumanize them. And they need help. And so for us, it's really a matter of thinking about how can we house them. In CCF is funding an effort that is being very successful and actually growing. And the latest is the Hollywood Bowl, the parking at the Hollywood Bowl. We are funding organizations that literally provide parking for people living in their cars. We talk about the homeless on the street. There's a whole community of families and individuals living in their cars. So we're funding so that large parking facilities, they can come in the evening, have a meal, have a safe place, and in the morning leave in their car. So there's different solutions that one needs to look at in order to ensure that as many people as possible have a roof over their head, and or that while they're in their cars with their families. I mean, you have literally families living in cars. So we're trying to find other facilities, churches, public places where we can fund, organizations that are providing. And when they come into these places, they have showers, they have bathrooms, they have a meal. And most importantly, that we don't talk about is the feeling of safety, that they're not going to be harassed. So, it's a long-winded answer, but, there's a lot of things that people can do to address the problem.
It's a great answer. And speaking of sort of being on the front lines and leading an organization that is trying to serve people experiencing homelessness during this pandemic, and we heard Antonia sort of lay out, a variety of creative responses. I'm wondering, Lecia, from your perspective, how has the pandemic affected your ability to serve your stakeholders?
Well, I just wanted to say before I answer that question fully is that we really saw our work around homelessness shift when we started to integrate homeless services and medicine. When we started to create models where multidisciplinary teams were going and doing outreach, where there was a physician on the team or a nurse practitioner, along with a social worker or someone with lived experience, we started to see a profound increase in our effectiveness and the responsiveness of our clients, because oftentimes it's that physician that says, your feet don't look good to me. It looks like you might have high blood pressure. Do you have diabetes? We'd like to take your temperature. And sometimes that person just feeling that someone cares, that it's a physician, it can be profoundly different and just enlightening for that person to feel like someone cares. As for COVID, again, we were already in the middle of a type of pandemic around the homeless crisis and the sad numbers that we've already heard, with 75% of the folks who are out there are unsheltered. And so COVID did provide to an additional challenge. But because we had already been looking at the most vulnerable and really looking at the intersection of health and homelessness and mental health, we were able to turn to those folks who were the most vulnerable to contract COVID, target them, and move them into what we called the COVID hotels, which was actually the opposite. The idea was for them not to get COVID. And we've seen really low numbers of positivity rates of COVID-19 among the homeless. And we believe it's because we did shore up those gaps. We worked with the nurses, we worked with social workers, we worked with individuals with lived experience, and we did whatever was needed. We also have a number of folks in permanent supportive housing. These are people who were homeless, who we've housed over the years. And we were able to take grab and go meals as a result of the help from United Way and other funders who just being so generous of making sure that we had the support we needed for people who are vulnerable, not to have to get out there and worry about how they're going to get food and groceries, et cetera. So we've had to shift. We've had a task force pulled together. We're so grateful for all the support around PPE, which was just so important because we have those frontline essential workers, those heroes that are doing whatever it takes. And every day they get up and make sure that people are nurtured, to make sure that children have the support that they need, even though many of our vulnerable families that we serve, whether we're in motels or whether they're in our RV project funded by the governor, to make sure that those kids are engaged in distance learning. So it is all hands on deck at St. Joseph Center, doing whatever that we can to ensure that our clients are safe, that they have the help that they need, and that they don't contract COVID-19.
The care model that you described at the beginning of this answer, that was a care model that was put in place pre-COVID.
That's exactly right. I mean, we have been working from a multidisciplinary space and perspective for some time because we've realized that it's folks who are the most vulnerable, oftentimes the frequent utilizers of the hospital systems and ERs, those folks that we are all worried about, that we pass day after day, and we worry if they're not going to make it. And we realized that we needed to shore up our systems and bring medicine to those encampments. And that's really been a profound change in our work over the last 10 years.
You know, Elise, to hear Lecia talk about the hotels, the non-COVID hotels, it makes me think of, you know, what at the outset of the pandemic was viewed by many as the most urgent need, and I think that manifested itself, at least in part, in something known as Project Room Key, which has gotten some media attention of late. And I guess I've got a two-part question for you. One, could you talk a little bit about your perspective on Project Room Key and what worked, and if you think something didn't work, what didn't work around it? And then, you know, now where we are at this moment in time as it relates to the pandemic, what you think the most urgent need is that needs to be addressed in the homelessness crisis here in Los Angeles?
Two easy questions. You know, what I always say about this issue that I want people to feel hopeful about is, you know, Project Room Key, while we didn't get to as many folks as we wanted to, we did move very quickly. We did get almost 5,000 people into rooms. And again, it was kind of an all hands on deck approach, but we had the funding through the CARES Act to do it. And this is our biggest challenge with homelessness, is looking at, we can make an impact when we have ongoing dedicated sources of funding. And so that to me is hopefully the opportunity that really shows us we can move quickly. I mean, I would be remiss if I didn't mention, though, that an issue we face, whether it's hotels or permanent supportive housing, is neighborhood support. And so, you know, I would just say to everyone on this convening tonight, you know, being part of the solution is saying we want to help our most vulnerable neighbors get inside. We want to help them get housed. And what we know is what Antonia said: when people are housed, they can then have all the services they need, whether it's mental health care, it's, you know, health care to treat their health conditions. But leaving people on the streets who are this sick, especially the ones that particularly break my heart are folks that struggle with mental illness. You know, I have family members, all of us are struggling, and, you know, to deal with that on the street is just unfathomable. So I think it's breaking down some of the stigma that doesn't create an added barrier. And a lot of it is just demystifying, as Tom mentioned at the beginning, the complexity of, it's not one monolithic population. I think it's important for your viewers to know that of that 66,000, only 25% are what we call chronically homeless, dealing with mental health, dealing with healthcare issues on the streets a long time. 75% are what Antonia's talking about, folks in the parking lots. And so, you know, we have women, we have youth, we have veterans. So we have an effort called Stories from the Front Line, where we really show, you know, for me, the optimism of this is we do have a model that works. And when people get housed with the services they need, their lives can transform. They can be an amazing neighbor. I've met so many amazing people. The last time, one of the first times I toured a permanent supportive housing site, the woman who had me in her home, she had been a city council member. She had worked at JPL. She had a nervous breakdown. She was living behind a dumpster. She got housed. And when I came in, she had made us homemade cookies and she was thriving. And so that's the power of housing. And we shouldn't be scared to welcome our homeless neighbors in. The other thing I would just mention that I think is an important point, because I think a lot of your viewers probably care about healthcare, and I know Cedars does, is the data from Project Room Key showed gaps in health insurance. And what I would say is, many of the folks that were in came into the hotel rooms, they were eligible for coverage. They were qualified. But we have to remember that coverage doesn't translate always to access. And so having them in hotel rooms really provided that link to be able to get their coverage so that they can have health care. And then the last thing I would say is, I think it's amazing what Lecia and her team do each and every day. But, you know, our health delivery systems are really designed to happen in four walls where people come to get services. And what I'm seeing and what Cedars is helping to expand is we're seeing much more of that focus of mobile healthcare delivery systems, and going to where people are is kind of meeting them where they are to kind of get them into a system of help. And that to me is game changing. And that gives me a lot of hope, because if we can, that is often a way that they trust nurses and doctors. If someone's helping them with their health, we can start to build that trust to bring them inside. I know that was a long answer. I'm sorry.
I asked a compound question though, so it's only fair that you give a longer answer. You know, Antonia, I think of you as a living legend in so many arenas and in so many ways. But you're someone who's spent the vast majority of your career fighting for the rights of others, and 2 or 3 times in Elise's response to that last question was this notion of people supporting their homeless neighbors, or, you know, conversely not supporting their homeless neighbors. I'm curious, from your perspective, are we doing enough as a society to build support for co-locating people experiencing homelessness in neighborhoods? What more can we be doing as a society, and what more can leading institutions be doing to catalyze that?
I think first of all, no, we're not doing enough. And in many ways, we have created this problem. And when we closed our mental institutions and put people on the street, that's part of the consequence. When people are released from confinement and they're put on the streets, that's part of the problem. I think the larger issue, Art, is this. First of all, it's a solvable problem. And one of the challenges is people think that it's not solvable, that it's so huge, that it's so big. And to me, that's an easy excuse not to get involved and not to take control. Secondly, putting aside the issue of homelessness and connecting it to health, we have a very stratified, expensive healthcare system that excludes a lot of folks. And so we need to look at, you know, yes, for instance, you know, recently, you know, Homeboy, you know, they bring the van, you know, from St. John for the examinations, and that's what Lecia does in different areas. This morning, I went to the Flower Mart. And if you want to get a sense of the homelessness, go to the Garment District, go to the Flower Mart. And we tend to walk around people. We tend to avoid people. And my view is this. First of all, you have to take responsibility for the institutions that have created this environment. And we have to be honest within ourselves. And it's so much more expensive to have a person on the street than it is to care for them. We are penny wise, pound foolish. And so we need to think creatively of how to house them. And housing is really expensive. And we at CCF fund building of low-income housing. And, you know, the low-income housing nonprofits and others have to think differently and innovatively. You know, right now it costs $550,000 to build a unit. Well, are there other ways? Do we have mobile homes? Do we have prefabricated homes? Do we look at this, you know, communal living like a dormitory and whatever? We talk about hotels and motels. for the government to buy motels and hotels and refurnish them. There are so many solutions that in the long run would be so much cheaper, not only for government, but for us as taxpayers. So my view is it's solvable, it's doable, but we not only have to, and Cedars is a wonderful institution and we're partnering with you. I'll give you an example. We're partnering with you on home care facilities. And most of our public doesn't know that there are homes that house those individuals with mental disabilities. Well, we have to work with the government to increase the funding that they provide to these providers. And we have to upgrade the facilities so that we're able to put more people in those facilities. We know what the solutions are. The challenge is we have to bring them up to scale. It's wonderful to have a little boutique program here and a little boutique program there, but that's not going to solve it. So, I think the passage of HHH and H has given us the resources not to solve the problem, but to begin to address it. The commitment with HHH was that we were going to build 10,000 additional units. And there's a sense of frustration in the public that, they passed HHH and the next day they want to see the housing. Well, it doesn't happen that way. But right now, we have in construction coming into use, hundreds, if not thousands of new houses, new homes coming in different parts of LA County. But the problem and the challenge that I see is when we past HHH and H, people thought we solved the problem. No, that was just a down payment on the long-term process of providing homes to the homeless. It's a down payment. 10,000 new homes. It's not going to house 66,500 individuals on the street.
And if I could add to what Antonia is saying, a stunning statistic that people, when they hear it, so we've lost 200,000 units over the past decade of apartments that rent below $1,000. So Antonia mentioned this, but we have to remember that our homeless crisis is our housing crisis. And so this is something we're all trying to work on. But, the federal government has cut rental subsidies in half, and that matters. When your rents are soaring and people are paying more income for rent, to not have any subsidy to keep them in their apartments. So we're housing more people than ever before. And I agree with Antonia, H and Triple H have been amazing down payments. But it's when we get the alignment of all levels of government that we can really tackle this issue. And move upstream for prevention. And really, we're not stemming the inflow. And, there is a measure on the ballot, Jay, that's going to try to move upstream, which I think is important. But actually, HUD can do a lot to help us through this. And I know that is a nonpartisan issue across the country, is to really look at how we start to stem the inflow of people becoming homeless.
So hold that thought for a minute. We'll, if we have time, we'll come back to the Measure J question for a second. I want to turn to Lecia for a second, because we talked about homelessness as a health crisis at the beginning of this broadcast, and you just described homelessness, of course, as a housing crisis too, as a housing problem. But I think it's hard to think about homelessness without thinking about the race dimensions as well. And I know, Lecia, that you and I talked a little bit about that last week, and I'm wondering what your thoughts might be on that aspect of the homelessness crisis and issue.
Well, I think admittedly, we haven't always looked at the intersection of race and homelessness. I think part of it is because we just all want to help everyone, right? We believe that everyone deserves to be housed. And we've always gotten this sense that it could happen to anyone. But over the years, when we've really looked at the data, we've seen that there's actually a disparity in homelessness that we can't ignore any further. And that's the overrepresentation of Black people who are homeless. And it's not even explained by poverty levels. So even in LA County, where Black people only make up 8% of the population, unfortunately, Black people are about 35% of the homeless and unsheltered population. That disparity really speaks to the structural and institutional racism that we've all really become more and more aware of in the last few months, particularly since COVID-19 and the sad murder of George Floyd. And it's caused all of us to step back and recognize that if 1 in 4 of the homeless individuals are in fact Black, there's no way we will end homelessness without addressing racism, without just admitting that it isn't something that could happen to any of us. Oh, sure, it could, but it is actually more likely to happen to my family than some other families, than white families. And why is that? What are we talking about in the legacy of structural racism? We're talking about slavery. We're talking about Jim Crow laws. We're talking about redlining that kept Black families from being able to purchase homes in certain communities, and that banks failed to invest in communities that were more of color than white communities. They were graded and scored. And all of that came out of government programs and government policies that were inherently biased. And then we talk about mass incarceration and policing. And so we just, again, and I realize in this work, and each of you have been very helpful to St. Joseph Center in particular, to allowing us to ramp up our services and feed those who are food insufficient and house those who are unhoused. But we have to also ask ourselves, why are so many people of color so reliant upon the nonprofit service system? Why are so many people of color unhoused, impoverished, and falling into homelessness every day? And it's only through looking at a structural situation and using a systemic lens will we be able to combat some of these very serious issues.
And let me add something
Oh, go ahead.
that Felicia brought up. We still have covenants where African Americans and others cannot buy homes. If you look at our suburbs, if we look at the NIMBY issue, that, you know, the perception that you don't want those type of people, whether they're African American, Latino, immigrants, you know, it's the perception of, you know, safety and who should be your neighbor and who should not be your neighbor. We have created a segregated society, and we see it. We see it in the most diverse county in the country, LA County. And so those are the structural issues that we have to deal with in order to move beyond. And, you know, it's all of these structural issues based on race don't go away just because you change something today. They build up over generations. And so we have to look at it from the, you know, the long term. But thinking about our communities, and you said, you know, what can individuals do? Self-examine yourself. Where you live, look at your neighborhood. Think about, you know, who would you have as a neighbor? And I think that that's part of the issue that we have to deal with. You know, we're the most integrated, and we talk about our diverse society and that we're so inclusive. Just look at the housing patterns, and you will be disabused about that illusion that we are so inclusive and diverse, and we live within, you know, together. and kumbaya, because it doesn't happen.
It's remarkable when you see that data. This could be its own hour-long or even longer sort of master class in these equity and inclusion issues that we've just talked about. We're at the end of our program, and I have to tell you, when we were thinking about launching the Embracing Our Community Live series, our dream team for the first program was the three people you're looking at today. They happily all said yes to us. Lecia Adams Kellum, Antonia Hernandez, and Elise Buik, thank you for making that a reality. And to those of you who are watching, we don't want to be greedy with your time, but we're going to be sending out a very brief survey, and your feedback on this first event would be invaluable. So thank you all very much for helping us launch Embracing Our Community Live. We wish you a good evening, and we look forward to hosting the next program in our series in the new year. Thank you.